Assalamu alaikum. I'm Professor Dr. Haider Jawad Mubarak. This is a practical presentation to osteology of the skull, part 2. It includes special regions. First of all, we will talk about the cranial cavity. The cranial cavity of the skull could be seen when we remove the cranial vault or the brain cup or the calvaria. And you can see here the cut margin showing an inner compact bone and outer compact bone, and in between these is a spongy bone which is called diplu. The cranial cavity could be described in form of the three cranial fossa, the anterior, middle, and the cranial fossa. These cranial fossa are arranged in the form of the step of a ladder in which the posterior cranial fossa is the most inferior, and higher than the posterior cranial fossa is the middle cranial fossa, and the anterior cranial fossa is higher of all. We will describe each of these cranial fossa, the anterior, middle, and posterior, in terms of bones forming each of them and features of each of them, starting with the anterior cranial fossa. The anterior cranial fossa is formed by the following bones. In the median region, it is formed by the cribriform plate of ethmoid anteriorly and by the body of sphenoid posteriorly. Here, the body of sphenoid is called the jugum sphenoidale. While on the sides, the anterior cranial fossa is formed by the orbital plate of a frontal bone anteriorly and the lesser wing of a sphenoid posteriorly. You can see that the body of a sphenoid, the jugum sphenoidale, is attached on the sides to the lesser wings of sphenoid on the right and left side. Features of the anterior cranial fossa. Here, the cribriform plate of ethmoid shows many perforations. These perforations allow passage of olfactory nerves down to the nasal cavity that lies deep to the cribriform plate of ethmoid bone. And also the cribriform plate of ethmoid shows in the midline a tooth-like projection which is called the crista galli. There is a foramen anterior to the crista galli which is called foramen cecum. The cribriform plate on the side of the crista galli contains the olfactory bulb that ends posteriorly to be connected with the olfactory tract. And this olfactory bulb gives the olfactory nerves that passes through perforations of the olfactory plate. So this is the crista galli. Anterior to it is the foramen cecum. Anterior to the foramen cecum is the frontal crest. And here we can see the frontal air sinus that may extend partly into the orbital plate of a frontal bone. The suture of the cribriform plate of ethmoid with the orbital plate of a frontal bone shows in the middle of it an anterior ethmoidal foramen, and at its posterior end is the posterior ethmoidal foramen. The orbital plate of a frontal bone shows irregularity that simulates the irregularity of the gyri of the undersurface of the frontal lobe of the brain, specifically the orbital gyri. We can see that the posterior border of lesser wing of sphenoid forms the posterior boundary of the anterior cranial fossa. This posterior border of lesser wing of sphenoid projects backward at its medial end to form a process which is called anterior clinoid process. And we can see that the junction of the lesser wing of sphenoid with the body of sphenoid is containing a foramen which is called optic canal that allows passage of optic nerve. Between the right and left optic canal is a sulcus which is called chiasmatic sulcus or optic chiasma sulcus. This is all about the anterior cranial fossa. And now we will describe the middle cranial fossa. The middle cranial fossa has a shape just like a butterfly with a small region in the midline and two lateral wings. Bones forming the middle cranial fossa, the mid region is formed by the body of sphenoid. The lateral regions is formed anteriorly by the greater wing of sphenoid, posteriorly by the anterior surface of petrous temporal bone, and laterally by a small region by the temporal bone. This is the region of the temporal bone, this is the petrous temporal, this is the greater wing of sphenoid. Features of the middle cranial fossa, starting with the mid region of the middle cranial fossa. This mid-region contains the fossa which is called hypophyseal fossa, containing the pituitary gland. Sometimes it's called sella turcica. Anteriorly, this sella turcica is limited by a transverse ridge of bone which is called tuberculum sella. the lateral ends of this ridge of bone is called middle clinoid process. While posteriorly, the hypophyseal fossa or the sella turcica is limited by a bar of bone that is called dorsum sella. The superolateral angles of the dorsum sella, this is a bar of bone which is called dorsum sella. The posterolateral angles of the dorsum sella, this and this, is called posterior clinoid process. Therefore, this is the posterior clinoid process, this is the middle clinoid process, and this is the anterior clinoid process. On the side of the sella turcica, the hypophyseal fossa, are the cavernous sinus on the right and left side. And here the bone shows a groove for the carotid artery, for the internal carotid artery. Features of the lateral part of the middle cranial fossa. Here, the lateral part of middle cranial fossa is connected anteriorly with the orbit by a space deep to the lesser wing of sphenoid. So here, deep to the lesser wing of sphenoid, we have a space which is called superior orbital fissure that connect the middle cranial fossa anteriorly with the orbit. And behind the posterior end, the medial end of the superior orbital fissure is a small foramen which is called foramen rotundum. This foramen connects the middle cranial fossa with the pterygopalatine fossa, and it is for entry of maxillary branch of trigeminal nerve. Posterolateral to the foramen rotundum is another foramen which is foramen ovale, and posterolateral to foramen ovale is the foramen spinosum. Of course, these two, foramen ovale and spinosum, connect the middle cranial fossa with the infratemporal fossa. The foramen ovale transmits the mandibular branch of trigeminal nerve. Also here in the lateral part of the middle cranial fossa, you may see groove of middle meningeal vessel, which is also shown here. The anterior surface of petrous temporal shows the following features from medial to lateral. Most medially at the apex of petrous temporal is a foramen which is irregular in shape that is called foramen lacerum, which is closed by cartilage in living that is perforated by some blood vessels. Behind the foramen lacerum is a depression or a concavity for the ganglia of the trigeminal nerve, the fifth cranial nerve. And behind the concavity of trigeminal ganglia is a groove for the greater petrosal nerve that leads to foramen lacerum, and behind this groove of greater petrosal nerve is a groove for lesser petrosal nerve that leads to the foramen ovale. More posterior to these two grooves, this region is prominent and is called arcuate eminence. It is produced by the underlying anterior semicircular canal of the inner ear. The piece of petrous temporal anterior and lateral to the arcuate eminence is called tegmen tympani. This is all about the middle cranial fossa. And now we will pass to the posterior cranial fossa. The posterior cranial fossa is formed of, in the midregion, by a piece of bone which is called the clevus. In the midregion, this is the clevus. Behind the clevus is the foramen magnum, and behind the foramen magnum is the squamous occiput bone. The clevus is formed partly by a body of sphenoid, and the major part of the clevus is formed by the basal part of occipital bone that form the anterior boundary of the foramen magnum. Here the foramen magnum is bounded anteriorly by this basio-occiput, while anterolaterally it is bound by the condyles of occiput, and the remaining part of the lateral boundary and posterior boundary of foramen magnum is formed by the squamous occiput. Behind the foramen magnum in the midline, we can see the internal occipital crest. This is the internal occipital crest that extends between the foramen magnum and the internal occipital crest, extending between the foramen magnum and the internal occipital protuberance. The lateral parts of the posterior cranial fossa is formed by the posterior surface of petrous temporal, by the squamous occiput, and partly by the mastoid temporal bone. So this is the internal occipital protuberance, and between it and the foramen magnum and the midline is the internal occipital crest. You can see that the internal occipital protuberance shows a lateral grooves on the sides, right and left side, These are grooved for the transverse venous sinus that meet in the internal occipital protuberance, and superiorly it shows the groove of posterior part of superior sagittal sinus. This groove of transverse sinus projecting from the sides of the internal occipital protuberance continues with an S-shaped groove which is for sigmoidal venous sinus. The sigmoidal venous sinus ends into the jugular foramen, and this jugular foramen is connected anteriorly with the inferior petrosal sinus. The upper margin of petrous temporal bone between its anterior surface and posterior surface of petrous temporal bone, this upper margin contains superior petrosal sinus, venous sinus, while here is the inferior petrosal sinus that is anterior to the jugular foramen. Of course, the inferior petrosal sinus is the suture between the basal part of the occiput, or called basio-occiput, and petrous temporal bone. Above the jugular foramen, the posterior surface of petrous temporal bone contains a foramen which is called internal auditory meatus or internal acoustic meatus. The condylar part of the occiput bone forming the anterolateral part of foramen magnum shows the hypoglossal canal that transmits the hypoglossal nerve, and the jugular foramen is covered by jugular process. These are the most features of the posterior cranial fossa, and this is the end of the description to the cranial cavity. Now we will describe another special region, which is the orbit. The orbit is a cavity which is four-sided pyramid. Its base is anterior, which is formed by the margins of the orbit, and its apex is posterior. Of course, its base is formed by the orbital margins, and we describe that these margins. The upper margin is formed by the orbital plate of a frontal bone. The lateral margin is formed by the zygomatic process of a frontal bone and the frontal process of zygomatic bone, while the lower margin is formed by the zygomatic bone, and by the maxilla and the medial border. So it's formed by the maxillary process of frontal bone and the frontal process of maxilla. I will repeat, the upper border is formed by the orbital plate of by the frontal bone, specifically the upper border is formed by the frontal bone, the lateral border by the zygomatic process of frontal bone and the frontal process of zygomatic, the lower border by zygomatic bone and maxilla, and the medial border by the maxilla and the frontal bone. The frontal here shows maxillary process, and the maxillary bone shows the frontal process. So this is the base of the pyramid. Therefore, it is four-sided pyramid. The roof of the pyramid, the upper, the superior wall, is formed by the orbital plate of frontal bone anteriorly, and posteriorly by the lesser wing of sphenoid. The lateral wall is formed by the greater wing of sphenoid posteriorly, and the frontal process of zygomatic bone anteriorly. And you can see that in between the lateral and superior wall, there is a fissure in the posterior part of the junction of the lateral and superior wall. This fissure is called the superior orbital fissure that connects the orbit with the middle cranial cavity. The inferior wall is formed by the zygomatic bone and by maxilla, and there is also a fissure in between the inferior wall and the lateral wall, which is called the inferior orbital fissure. This inferior orbital fissure connects the orbit anteriorly with the infratemporal fossa, but it connects the orbit posteriorly with the pterygopalatine fossa. Lastly, the medial wall of the orbit is formed from posterior to anterior by the body of sphenoid, by the orbital plate of ethmoid, lacrimal bone, which is a small bone, and by the frontal process of maxilla. You can see here anteriorly that we have a lacrimal groove. This lacrimal groove is formed partly by the frontal process of maxilla and partly by the lacrimal bone, and this is the suture between the frontal process of maxilla and lacrimal bone. This lacrimal groove continues with the or contains the lacrimal sac and inferiorly it is open to the nasal cavity by the nasolacrimal duct. And that's why when someone is crying, the lacrimal fluid is accumulated in this lacrimal sac and passing through the nasolacrimal duct here inferiorly into the nose. And we can see the anterior and posterior ethmoidal foramen at the suture between the orbital plate of ethmoid and the orbital plate of frontal bone. Posteriorly, the roof is formed by the lesser wing of sphenoid, and the medial wall is formed by the body of sphenoid. And between the lesser wing of sphenoid and the body, this is the optic canal transmitting the optic nerve. Also, the roof shows in the lateral side a depression or a space or a fossa here, which is the lacrimal fossa in the roof. Laterally, it contains the lacrimal gland. Also, the floor shows here above the infraorbital foramen, the floor shows infraorbital groove that leads to the infraorbital foramen. The lacrimal groove, this is the lacrimal groove, is said to be bounded by lacrimal crest, and therefore the anterior lacrimal crest is a crest in the frontal process of maxilla, while the posterior lacrimal crest is into the lacrimal bone. Of course, this is a very weak region. The cribriform, the orbital plate of ethmoid and the lacrimal bone is very weak region. Sometimes, if someone holds the skull from this region, it will be broken. You can see how the frontal air sinus may extend partly into the orbital plate of frontal bone. That's why sinusitis, inflammation of the sinuses, the paranasal sinuses, which is specifically frontal sinus, may lead to pain that is referred to the orbit. And this is all about the orbit. Regarding the mandible, I think we had described something about the mandible. The mandible is formed by lower part, which is U-shaped, that is called body of the mandible. And we said that this U-shaped body of the mandible connected bilaterally into a rami that extends upward. The posterior part of the body connected with the rami. The upper border of the body of the mandible shows the alveolar process carrying the teeth. The anterior midline region of the body shows triangular bone prominence, which is called mental protuberance. The apex of it is mental symphysis, while the lateral angles of it are the mental tubercles. From the mental tubercles, there is an oblique line that continues with the anterior border of the ramus of the mandible. At about the middle of this oblique line is the mental foramen that lies in between the first and second premolar tooth. And we may see here incisive fossa just below the incisor tooth. This is all about the body of mandible from the outside. From inside, the body of the mandible shows behind the mental symphysis tubercle, which is called genial tubercle. And from this genial tubercle is a line that extends backward and upward to the region behind the last molar tooth. This line is called mylohyoid line. Above this mylohyoid line, the inner surface of the body of the mandible contains the sublingual fossa for the sublingual salivary gland, while below the mylohyoid line is the submandibular fossa for the submandibular salivary gland. The ramus of the mandible is quadrilateral. Its anterior border continues with the oblique line of the body. Its superior border forms a mandibular notch that project anteriorly as a coronoid process and posteriorly by the condyloid process. The condyloid process is formed of a head, and below the head is the neck, and this head forms the temporomandibular joint with the temporal bone, with the mandibular fossa of temporal bone. The anterior surface of the neck shows a fossa or fovea for lateral pterygoid muscle, and this is the mandibular notch between the condyloid and coronoid process. You can see that the inner side of the ramus of the mandible contains the mandibular foramen. This mandibular foramen have an anterior projection which is called lingula, and from the mandibular foramen there is a mylohyoid groove containing mylohyoid nerve. The lower border of the body of the mandible here may show bilateral digastric fossa for the digastric muscle. These are most of the features of the mandible. And now we may describe some features of the nasal walls, although these features will be studied with the lecture of the nasal cavity in the head and neck. But here we can see the nasal septum is formed by the perpendicular plate of ethmoid bone above and posteriorly, and by the vomer below and posteriorly, and anteriorly by the nasal septum, and behind of all is the vertical, this is the vomer, posterior inferiorly, and the perpendicular plate of ethmoid posterior superiorly, and anteriorly by the nasal septum. Of course, there's more details about this nasal septum, but here I want you to see the sphenoidal air sinus inside the body of sphenoid. It lies below the jugum sphenoidale. This is the jugum sphenoidale in the anterior cranial fossa, and this is the sella turcica. So you can see that the sphenoidal air sinus is below the jugum sphenoidale, and sella turcica both are body of sphenoid. This is the dorsum sella. This is the clevus formed by body of sphenoid and basio-occiput. Again, another view for the nasal cavity. This is the lateral wall of the nasal cavity. It shows three bony projections that are called the concha: superior concha, middle concha, and inferior concha. The superior concha and the middle concha are parts of the ethmoid bone. The inferior concha is a separate bone by itself. Also, the lateral nasal wall are formed by the nasal bones, by maxilla, by the vertical plate of palatine bone. You remember that the heart plate is formed by the horizontal, by the palatine process of maxilla anteriorly, and posteriorly the heart plate is formed by the horizontal plate of palatine bone. And we said that the horizontal plate of palatine bone is connected with the vertical plate of palatine bone to form L-shaped bone. So this is the vertical plate of palatine bone behind the concha. This is the vertical plate of palatine bone, and this is the horizontal plate of palatine bone. You can see that the vertical plate of palatine bone forms the lateral boundary of the posterior nasal aperture. This is the medial pterygoid plate, and this is the lateral pterygoid plate, and the junction of the medial and lateral pterygoid plate is called pterygoid process. And this is a suture between the pterygoid process and the vertical plate of palatine bone, or called perpendicular plate of palatine bone. Again, these are features of the nasal cavity. Of course, we said that the nasal cavity will describe in details with the topic of the head and neck. We had just described that when we cut the zygomatic arch, we can see the posterior surface of petrous temporal, and this is the pterygoid process. This is the medial lateral pterygoid plate, and this is a fissure which is called pterygomaxillary fissure between the maxilla and the pterygoid process. It leads to pterygopalatine fossa, and here are some of the features of the pterygopalatine fossa. Of course, details of these will be taken with the head and neck also. Finally, I want everybody to be oriented to the relation of the osteology of the skull to parts of the structures that I will describe here, a mid-sagittal section of the head. You can see this is the medial aspect of the frontal of the cerebral hemisphere. This is the corpus callosum. You can see that the frontal lobe lies in the anterior cranial fossa. Of course, the temporal lobe will lie in the middle cranial fossa, while the occipital lobe will lie above the cerebellum, and both the occipital lobe and cerebellum are separated by this fissure, which is called transverse cerebral fissure, and the cerebellum and the occipital lobe lie in the posterior cranial fossa. So the anterior cranial fossa contains the frontal lobe, the middle cranial fossa contains the temporal lobe, and the posterior cranial fossa contains the cerebellum and the occipital lobe. You can see here the clevus, which is formed by body of sphenoid and base part of occipits, is related to the brainstem. This is the brainstem related to the clevus. This is the nasal cavity. Sometimes we may have operation to remove the pituitary gland. Of course, this is the thalamus. This is the hypothalamus. This is the fornix. This is the septum pellucidum. You can see that the rostrum of corpus callosum ends into the anterior commissure. This is the lamina terminalis ending into the optic chiasma, and back posterior to the optic chiasma. This is the infundibulum of pituitary. The pituitary here lie in the sella turcica, and this is the mammillary body, and then the posterior perforated substance. This is the midbrain. This is the tectum. This is the pineal gland. You can see that sometimes tumor in the pituitary gland may be approached via an operation from the nose. We can enter from the nose to the sphenoidal air sinus, and then to sella turcica to remove the pituitary gland. You must be oriented with such a figure, because imaging anatomy is very important nowadays, and you must be familiar with such a figure. So you can imagine that in regard to cranial cavity, that this anterior cranial fossa contain the right and left frontal lobes, the middle cranial fossa contain the temporal lobes, and the posterior cranial fossa contain the occipital lobe and the cerebellum. And you can imagine that between the frontal lobe and temporal lobe here, the posterior border of lesser wing of sphenoid is related to the stem of lateral sulcus. These are the most of the topics that are related to the subject of the skull. Thank you very much.